Welcome to the Physician Wealth Med podcast. It's wealth medicine for doctors. If you're a doctor and you have no time, it looks like you found us just in time. This podcast is for all doctors who would like to work on their personal wealth, but do not have traditional hours to do so because they have no time. We're here to jump into topics that will help you address your wealth both inside and outside of your practice so that you can live the life of significance you're dreaming of. You'll hear from your peers, you'll hear from industry professionals, and your host and wealth advisor, me, Kevin Sullivan. This is your time. Now let's get started with today's podcast. Welcome back to Physician Wealth Meds, the wealth podcast for doctors. It's our goal and our mission to help provide clarity and confidence to help you build wealth both inside and outside of your practice that's going to last for generations. But today's episode tackles something that every physician listening has likely felt but may not have fully understood. Most doctors enter medicine to heal, to serve, and be meaningful relationships with patients. Yet somewhere along the way, medicine became filled with administrative burdens, endless documentation, prior authorization, insurance battles, declining autonomy, and increasing frustration. Physicians are working harder than ever, yet many feel more disconnected from their patients, their purpose, and even the profession itself. So the question is this simply burnout, or is it simply something much bigger happening beneath the surface? My guest today, Dr. Jordan Grumet. Many of you know Jordan from his previous appearances, his writing, and his thought leadership around purpose, fulfillment, and the physician experience. But today we're going to discuss his new book called The Healthcare Heist. In this book, Jordan explores ideas that physicians and patients have intentionally been placed on opposite sides of the healthcare experience, while powerful third-party interests profit from the dysfunction. He discusses what they call the culpability myth and also the intimacy gap, and why rebuilding trust between physicians and patients may be the key to reclaiming medicine itself. So whether you're a practicing physician, nearing retirement, or simply trying to make sense of the healthcare system that you've dedicated your life to, I think you'll find today's conversation eye-opening, thought-provoking, and perhaps even empowering. So let's get started. Dr. Jordan, welcome back to Physician Wealth Meds.
Thank you so much for having me. I'm looking forward to the conversation.
I was very excited when you reached out to me on this to discuss your book. I know you had said to me privately that you always have some book in the process and maybe 3 going at the same time. So I really appreciate this because this is a topic that is super interesting to doctors. They want to know more about it. They want to explore it. And I think your book is just perfect timing. So what was the moment when you realized that healthcare wasn't simply broken, but it was being systematically exploited?
Well, I always say that my healthcare career, my career as a doctor ended one night in the middle of my career. I eventually mostly left medicine, only did hospice and palliative care after that. But I was sitting watching TV with my wife and kids, and there was a knock on the door. And I walked to get over the door, opened it up, and I was handed pretty much a summons. It was a process server. And that started the whole process of being sued, something I had never been before. And I spent 6 years being sued, being depositioned, meeting with lawyers. And ultimately, in the 6th year, I was dropped from the case. And the lawyer himself finally admitted that he never thought I had done anything wrong, but he just wanted to use me as leverage to get a bigger settlement from the nursing home I was working with. And what I realized at that moment is I was leverage. I was being used for this third party. In this case, it was the medical malpractice system to make money. And the funny thing is I started thinking about all the problems I was having with medicine. And it wasn't only the medical malpractice lawyers, it was the pharmaceutical companies, the insurance companies, venture capital, and private equity. They were not only using me, but they were also using the patients as leverage in order to basically extract as much money as they could from our healthcare system. These third parties are taking the money out of the system and they're not adding any benefit in back.
That's incredible. And 6 years of your life turned upside down. That's incredible.
And it wasn't only mine. If you think about it, it wasn't just my life, because what happens when someone gets sued? Well, for one, it's depressing and anxiety causing, but it's not just the physician that's affected. It's the physician's practice, it's their employees, it's the insurance companies. Why? Because physicians who've been sued are much more likely to order more tests and send people to more specialists. It's called defensive medicine. Often the cost of healthcare goes up. So insurance costs go up, everyone's premiums go up. Because I was sued, I eventually burned out in medicine and I left my practice. So all those people I took care of lost their doctor. All those people who worked for me in my practice basically lost a job. So it was much more than I was just there as leverage for this lawyer in order to sue the nursing home. There were profound impacts of these acts from the medical malpractice world. And a lot of times we don't talk about the long-ranging economic impacts, as well as the emotional devastation, depression, burnout that happen because the system is really kind of rigged against us.
I mean, and it shakes you to your core. I mean, the very essence of who you are and what you're doing and why you're doing it, to have that kind of thing come at you full force shakes you right to your core.
And I could hear someone listening and say, oh, well, poor you. Patients are harmed every day by doctors and hospital systems, and without medical malpractice, we would be lost, which is what the medical malpractice insurers want you to believe. On the other hand, if you look at the data, and this surprises people quite a bit, 68% of lawsuits brought against physicians are dropped before they even make it to trial. 68%, no fine against the doctor, no money changed hands, they're just dropped. 68%. And guess what happens when you go to trial? 8 out of 10 cases fined for the physician and not for the plaintiff. So 8 out of 10 cases say that there's no medical malpractice. So if you think about it, based on those numbers, the likelihood of you successfully winning a malpractice suit, at least from the beginning, is well less than 10%. It's like 3 or 4% of these cases actually end up with a successful suit. You could say that means there's a systematic problem, but what I say is it means there's probably a lot less medical malpractice than we've been led to believe.
And then the amount of time that it takes away from your mission and what you want to do and all of that is incredible.
And let's not forget what it costs the system. So remember, there was a study actually done in 2008, and the reason I had to go all the way back to 2008 because there just aren't that many studies that show this. But basically, they looked at the impacts of medical malpractice suits, and there was something like $45 billion awarded in medical malpractice during that year. But guess what? It led to $55 billion worth of defensive medicine. So you might think medical malpractice is protecting patients, maybe even keeping costs down. But what happens is that doctors go back, they act more defensively, they order more tests, and guess who pays for all that? When a doctor orders more tests because they're worried about medical malpractice, it eventually gets paid by insurance or the government in the form of Medicare and Medicaid. And guess what then happens? Our taxes go up and insurance premiums go up. The thing is, you and I, we all are paying for this. It's not just a suit is being brought against a doctor and his insurance or her insurance is paying for it. The American public is actually paying for all this. And it's really expensive.
Wow. And thus the book. I couldn't have come at a better time. I'm glad you wrote that. Let's talk about the culpability myth. You described something called the culpability myth. Could you let our listeners know what is that and why it's so dangerous for physicians?
Yeah, basically the culpability myth is that doctors are responsible for all the bad things happening in medicine today. And there are a couple of reasons for it. The first is actually a study that was done by the Institute of Medicine in the late 1990s called The Air is Human. And it basically looked at accidents and problems within the healthcare system and in hospitals. And it said that 98,000 deaths a year, at least up to 98,000 deaths a year, were caused by mistakes in the hospital, either by doctors or other healthcare practitioners. The problem with that study is it's been debunked over the years. It was highly extrapolated. In other words, they took a very small number of cases and extrapolated them to huge numbers. And if you really believed that, then you'd believe like 1 in 2 deaths in the hospital were caused by medical mistakes, which we all just know isn't true. And this was the information the medical malpractice attorneys needed and seized on. If you go to your Google browser and write in medical malpractice, you are going to see multiple references to this study, To Err is Human. It was what they needed to convince people that they should be suing their doctors. So on one side, you have this idea that doctors are evil and they're causing all sorts of errors and they don't care. But then on the other side, in the 1980s, you had the rise of HMOs, and that was the gatekeeper model. And so the idea was primary care doctors were supposed to be the gatekeepers of our healthcare dollars. They were supposed to decide who got referrals, who could go see what tests, and who could see which specialists. And in the HMO model, you couldn't get any of that done unless your primary care doctor signed off on it. But here's the thing. No doctor, including primary care doctors, were actually trained in public health. We have a responsibility to each and every patient, not a responsibility to community health and making things cheap for the whole community. Our responsibility is for each patient. So if we see a patient and we think a test could really help them, even though it's very expensive, our responsibility is to suggest that test, not say, I'm sorry, this will cost society too much. You shouldn't get it. And so what happened is patients felt like their doctors were these gatekeepers and they were keeping them from the care they needed. And this wasn't only the HMO movement. Eventually, we got more sophisticated healthcare movements like accountable care organizations or ACOs. And the idea was to make the doctors more accountable for the cost of care. So the doctors were supposed to be the stewards of what care was given and how much it cost and how much each patient cost per episode of care. And so on the one side, doctors look careless because they're making all these errors. Then on the other side, they look stingy and they're not willing to pretty much pay for the healthcare dollars. And then on the other side, you have government regulation. There's something called the Physician Sunshine Act. Have you ever heard of that? The Physician Sunshine Act? No. So the idea was this. Pharmaceutical companies engage doctors, they put on programs, they pay lots of money, they bring them food into their offices. In trade-off, they try to convince them to use these pharmaceutical companies' drugs, right? The farm reps are constantly seeing doctors and trying to convince them that their drugs are the best to be used. So the government says, well, you know, that's probably not on the up and up. If they're bringing you food or giving you money or paying you speaking fees, you're going to use their drugs more than other drugs. And that is undue. And that is basically a lack of objectivity, and you're basically using the drugs for the wrong reasons. So they passed a law called the Physician Sunshine Act, which basically puts doctors on record. You can go as part of the public and look up any doctor you want and see how much money they received in meals from pharmaceutical companies. You can see if they've gotten any speaker fees. But here's the thing. That act was actually supposed to monitor not just physicians, but pharmaceutical companies and hospitals. But do you hear that in the name of the act? No, it's the Physician Sunshine Act. They don't mention the pharmaceutical companies. It's kind of unethical for those pharmaceutical companies to be throwing tons of money at doctors to use their drugs when they're not appropriate. They don't mention hospitals, which are bringing in all these pharmaceutical companies to pay for lunches and those kind of things. Basically, they've made this look like it is something that only doctors are doing wrong, which is really interesting because they've done studies and actually show that when doctors do take money from pharmaceutical companies, a lot of doctors do in the form of meals and things like that. But it comes out to somewhere between $500 and $800 a year. You're talking about a professional that makes $350,000 or $400,000 a year. And so, yes, they're getting $500, $700, $800 a year in food and other little trinkets from these companies. Yet the pharmaceutical companies are making billions on this undue influence. And yet it's the doctors who are being called out on this act. You can look up which doctor took which money, but it doesn't really even tell you which pharmaceutical company paid them. And
That's
so
amazing.
all of this is basically showing you that doctors are being railroaded as the cause of all the problems in the system. And it's just not true. And that is causing a huge divide between doctors and patients.
So how does this misplaced blame contribute to burnout, depression, or even physicians leaving the medicine altogether? I mean, what's their state of mind from your findings as you were writing this book?
Well, the problem is physicians are caught in the middle, right? And so as opposed to having a collegial relationship with their patients, instead, patients are angry. Patients think that the doctor's right. The whole story is the doctors have the most expensive cars in the hospital parking lot, right? So doctors are these overpaid people who are making lots of mistakes, who are taking money from the pharmaceutical companies and are committing malpractice. So your average person walks into the office and it's a confrontational relationship. So first and foremost, it's very easy to burn out because you don't feel like you're actually connecting to these patients who you're spending a lot of time worrying about and trying to help. But the other piece of it is these third parties that are trying to make money from the system, they're creating all sorts of friction in that same system that we grew up in. So I grew up back in the 1990s and early 2000s, and I would see a patient. They would come sit in front of me. I'd look them in the eyes. I'd talk to them. I'd jot a few notes, write a quick note as I was looking them in the eyes. I'd examine them. I'd spend 20 or 30 minutes with it. Most of the time when I was with them, I was looking them in the eyes and talking to them. I'd make a diagnosis or put in some orders, and that would be it. Now we have these electronic medical records which take our attention away from the patients. Patient visits take longer. They spend more time with non-physician staff. When the physician comes in, they're more interested in filling out the electronic medical record than they are actually talking to the patient or connecting with them. So what happens is you have a system in which that relationship between doctors and patients isn't as tight, and doctors have a lot more things on their plate. They have all the boxes they have to check and all the things they have to do on these electronic medical records, which would all be great if it led to better care. But when you look at the studies about electronic medical records, you actually see that after all these years and all these billions of dollars that went into electronic medical records, paying for the CEOs and all of their employees, big companies like Epic have made billions of dollars. And yet most of the studies show that electronic medical records haven't actually improved medicine at all. They've cut down on some kinds of errors, but increased the other types of errors. They haven't cut down on the cost of care. Basically, we were doing just as well before electronic medical records as after. But yet this is one more thing physicians have to do, which is taking their energy away from patients. Insurance companies throwing denials and pre-authorizations at physicians. So instead of doing patient care, they're on the phone arguing about pre-authorizations. You could go on and on. These third parties are putting up all sorts of roadblocks, which increase a physician's work, but doesn't increase their pay. It increases these companies' pay, and yet makes it harder and harder to actually just take care of patients. We talk about burnout, but often it's more moral injury, right? This idea that we know what's right for our patients, yet we order the test and it gets denied, or we don't have enough time to spend time with them because we're on our electronic medical record, or venture capital or private equity has taken over our practice and it's making us see 3 times the number of patients in the same office day where we used to see much less. All of this is changing, and it's causing doctors to work harder and harder. They did a study looking at how many hours a day would a primary care physician have to work to do the basic screening, fill out the electronic medical record, and do all the things that they're supposed to do. And they found that your average physician would have to work like 37 hours a day. It was impossible.
The other part of it is the other 50 hours at least that it adds to the doctor's schedule just to do the documentation at the end with the medical records. And when I go in, I always hear my doctor just wrapping things up verbally. You know, he goes in and transcribes. He has a PA helping just transcribe it and that type of thing. But everybody's got a story regarding that as a patient. And the doctor was in and out just because of the responsibilities. And it does lead to burnout. It's incredible. Thank you for going into that a lot more. So what would you say to a doctor? And like, do doctors have the power just to change that narrative somehow?
Well, here's the thing. what do you do when you have third-party entrenched interests that are basically creating a system that isn't serving the main stakeholders? So remember, who are the main stakeholders in our healthcare system? Well, they're the people who need care. That's you, I, and everyone else. And then the people who
Yeah.
deliver care. I'm saying doctors today, but we're really talking about doctors, nurses, nurse practitioners, PAs, occupational therapists, physical therapists, chaplains, social workers. I mean, it's a whole bevy of people providing care. I say doctors right now because it's just easy. But the main stakeholders are the doctors and patients.
Right.
But the problem is, right now, those stakeholders are being driven apart by the culpability myth, by all the things that are taking our energy away from patients and basically expending it on fulfilling these criteria necessary for these third parties so these third parties can make more money. And so it's not going to be a simple legislative change. You ask, what can we do to make this better? What can your average doctor do to make things better? We need a revolutionary change to our system to basically throw off these entrenched third-party wealthy interests. You're not going to get it through electing better politicians. You're not going to get it through legislation. You need revolution. I'm not talking about pulling up your pitchforks and your guns revolution, but I'm talking about we need the main stakeholders to come together to push for change. And when you get stakeholders together pushing for change, that's when things finally change. And again, that sounds a little bit ephemeral until you realize that's exactly what happens in the United States. How do we get change? Usually a story sparks change such that stakeholders come together, become allies, and push for that change. I'll give you a great example. The civil rights movement. Have you ever heard of Rosa Parks? Of course
Yes.
you've heard of Rosa Parks.
Yeah.
The story about the bus was a story that brought together major stakeholders that caused revolutionary change. Without that story, we don't have all the parties, the interested parties, come together and push against these huge entrenched interests that didn't want anything to change, right? Change wasn't just going to happen legislative on its own. It needed revolution. That's what we need in healthcare. We need the main stakeholders to come together, and the way you get that is through shared storytelling. The problem is, and this has always been a problem in healthcare, when patients come to our offices, they share all sorts of intimacy. They tell us about their biggest problems. They tell us about everything going on in their life. They take off their clothes, and that very much is unilateral intimacy. Doctors, on the other hand, don't return any intimacy. And of course, they shouldn't, right? When you come to your doctor because you're having chest pain, your doctor shouldn't be like, well, let me tell you about the day I had. So there is unilateral intimacy, there is distance, and it's important in the exam room. But the problem is, if you want stakeholders to come together, we have to have bilateral intimacy. How does that happen? Well, doctors are really good at telling people what they know. We're really good at telling people how to avoid heart disease and how to exercise and how to treat diabetes, but we're really bad at telling them who they are. In other words, we don't tell the stories about what it feels like to be a doctor, what we're facing, what are the stressors we have to deal with. So you don't do that in the exam room, but you do that in social media. You do that with writing and books and all those type of things.
Right.
But by telling our stories, we can actually have some shared intimacy. And once you get over that unilateral intimacy and we have shared intimacy, that's when these main stakeholders come together, and that's when we get change. And if you don't think it can happen, and people listen to me and they say, wow, that's like a big idea on how to solve the problem. And if you don't think it can happen, it actually has happened. So if you go back to the early 1900s, in the UK, they didn't have much of a healthcare system. And there was a doctor. His name was A.J. Cronin. And A.J. Cronin was a doctor. He saw kind of all the atrocities of how the healthcare system didn't work well. And he wrote a book called The Citadel. And this book, The Citadel, actually became so popular that it has been credited with a passage of the NHS in the 1950s. So basically, UK's universal healthcare system, often at least part of the credit goes to this fictional tale written by a doctor. It was a doctor who was telling his story about the intimacies of what he saw and about the atrocities of what it meant to the British people. That's how we get revolution. And that's what I think we need.
If you're going to define the intimacy gap, which you talk about, give us a quick definition of that.
Yeah. The intimacy gap is just the unilateral and profound intimacy patients express towards doctors, but doctors don't generally return. And I think it's a problem in our system. And this is why I've always pushed for doctors to be on social media, to write blogs, to do podcasts, to tell the stories of themselves and their patients. Now, of course, if you're going to tell a patient story, it has to be anonymized, or you have to get their permission. You can't just go and talk about your patient you saw in the office yesterday. But there are ways to do it out in the world because we want our patients to be our allies. I used to write a medical blog while I was seeing patients as an internal medicine doctor. And I remember one day, one of my patients came in for a physical, and I said, "How are you doing?" And he said, "I'm doing fine. Everything's great." And then he looked me in the eyes, looked me straight in the eyes and said, "And how are you doing?" And it was interesting because patients generally don't do that. And after talking for a while, I realized he had been reading my medical blog. And when we talked about it, he kind of looked at me and said, "You know what? I just didn't know my doctor went through all those things." See, he didn't know. He didn't know that day that I came in and I was busy and I was 10 minutes late and I was short with him. He didn't know that maybe I just left the room of a patient who I had to tell him that his wife was dying, or that my favorite patient was in the ICU and losing his battle. He didn't know, because we as physicians have never told people about what we go through day to day. And again, it maintains that intimacy gap. I'm a big fan of doing the opposite. I think we need to tell our stories. And again, if you go throughout history, you can find doctors who have told their stories and have changed the world. A good one is a guy named Sherwin Newland. Sherwin Newland was a famous surgeon, I think in the 60s and 70s, but he also famously had severe, severe depression. And he got so bad that he was going to go to the hospital and have a frontal lobotomy. They were going to literally cut out part of his brain because his depression and anxiety was so severe. He's a general surgeon. And one day, one of his residents said, "You know what? There's this new thing called electroconvulsive therapy. You should really try it." And so he tried electroconvulsive therapy, and it changed his life. His depression got better, and he was able to function more, and he went back to his career. In the early 2000s, before he died, Sherwin Newland did a TED Talk about electroconvulsive therapy. See, if you know anything about electroconvulsive therapy in pop culture, it's kind of presented as this horrendous thing that we did to patients. I don't know if you ever saw One Flew Over the Cuckoo's Nest.
Yeah.
But there's actually a scene where the patient gets electroconvulsive therapy and he's, holding on and his head's shaking and he's frothing at the mouth and it looks like the most horrible thing ever. Sherwin Newland told his story, did a TED Talk, and acceptance of electroconvulsive therapy went up. It's one of our most effective treatments now for difficult to control depression. But we wouldn't accept it as a community unless people like Sherwin Newland were, strong enough to go out there and tell their stories. This is how we change things.
And the vulnerability from both sides to be able to do that. Would you say doctors that maintain professional distances, is that model outdated? Or what would you say even to new physicians coming in to maybe adopt this before you get too deep, because you'll have a better success moving forward?
Yeah, so, it's interesting. If you look back through medical history, you'll see a lot of talk about a judicial level of obtuseness, which means a certain amount of distance, and equanimous, which was kind of an objectivity.
Yeah.
Here's the thing. If you go back into the 1800s and 1900s, even in the 1950s and 60s, your doctor, first of all, probably lived in your community. A lot of times you saw that doctor at church. You would know their kids because they went to the same high school as your kids. They would come to your house in an emergency and see you. And so this idea that there needed to be distance made sense because this person was integrated in your life. You totally knew them. You knew about their lives. And when they walked into the room and had to make a life-changing decision for you, they needed to be distant. And they were going to see you on the street tomorrow, so they couldn't, go talking about that STD you went and saw them for the other day.
Right.
So back in the day, doctors and patients were much more integrated into the same society. But now look at today. No one does home visits anymore. Most of the time, people actually have to drive to their appointments. So their doctor's office usually isn't in their community. Their doctors usually don't live in their community. They usually don't know them. They don't socialize with them. And so the problem is, back in the day, distance was really important. But now we already are so distant that actually we need a little bit of the opposite.
Yeah.
We need a little more connection with our caregivers. Yes, to be a physician who gives good advice, you have to be objective. But I think we'd actually benefit from a little bit less distance. We need to feel like colleagues. We need to feel like partners. And between the electronic medical records and the insurance fighting and the pharmaceuticals and medical malpractice, all of that has torn us apart. And in fact, we're more distant than ever. Yeah. We don't even look at our patients anymore. Again, our eyes are on our computer. We rarely look them in the eye. We certainly don't put our hand on their shoulder or hug them anymore.
Right. And that pendulum swung too far. It just needs to find that balance. And definitely we need to come back and see themselves as partners with their patients, however you want to term that, but at least be more transparent maybe. And especially to tell your doctors that they are human, they have feelings, they got all of that going on. And you're right. I would think 90% of us don't even look when we go see a doctor. We don't even know what's gone on with the appointment right in front of us or behind us, or even that morning. And to be more empathetic that way is incredible.
I think we need bi-directional flow of empathy. Yeah. I think doctors need to understand patients more and patients need to understand doctors more. The only thing I'll tell you is doctors naturally understand patients because they've been patients before and their family members have been patients. Most people become doctors. Partly they became doctors because they went through a health problem themselves or their family member did. Yeah. The other side isn't true, though. Patients don't really know what it feels like to be a doctor, but that's partially because we don't tell them. And this gets back to the intimacy gap. I think if I was to leave you with anything, I think that's our best solution is we need to start telling our stories. We need to become allies again. And only then can we stand up so strongly in such huge numbers together that we can force our political system to change.
As a reflection on the book, two things. What surprised you most during the research for this book? And was there anything that you discovered that made you angry?
Oh, God, so much of both. I mean, what's really scary is how dirty it gets. So let me explain. Let me give you an example. Yeah. Pharmaceutical companies basically make new drugs and then they get patents. They get a certain amount of patent time. It's basically to protect the research and development. We want pharmaceutical companies to at least be the only one who can make that drug for a certain amount of time so they can recoup all their R&D costs. There are a lot of reasons why actually their R&D costs are not as high as they say they are, but we won't get to that. But when you get to the end of the patent, basically there's this whole process where it comes off patent, and then pharmaceutical companies can jump right in the generic companies and start making that drug. And what happens is very quickly the cost of the drug drops as the generic companies start making them. So here's the thing. Let's say you are in a company that creates a blockbuster drug. It's been protected for 10, 15, 20 years. Nowadays, they have ways of extending their patents so that they can go as long as 38, 40 years. You've been protecting your drug for all these years. Let's say you're making, 5 billion of sales a month or 1 billion of sales or whatever it is. It's that big of a drug. What they now do is the pharmaceutical companies go to the generic companies, the main ones, and they'll say, we'll give you 50 million a month not to make this drug. They actually go to the generics and pay them off because they'll make more money in those months in which the generic doesn't come out. It gets even worse. The pharmaceutical companies, when a drug comes off patent, part of the legislation having to do with it is you can write in a letter for why you think that drug shouldn't come off patent. And the government is required to review it before the patent ends. Well, here's the thing. The pharmaceutical companies send hundreds of these letters themselves, not interested citizens. The pharmaceutical companies send them, and it just takes them a week, 2 weeks, 3 weeks to adjudicate each of these claims. And so they push drugs going off patent sometimes for weeks to months based on just a letter writing campaign. And it's all spurious. It's just written to delay. It has nothing to do with actual a reason these drugs should come off patent. So, I mean, there's so many situations like that where you realize that a lot of this is a pure money play. Remember death panels. Do you remember during
Yes.
Obamacare, this idea of death panels?
Yes.
Things were labeled as death panels
Yeah.
because they didn't want end of life discussions. They didn't want hospice discussions. Guess who came up with that? Death panels, the term, was a marketing term made by a marketing company working for a health insurer, which was then rolled out to the politicians to kill Obamacare because they thought Obamacare was going to hurt health insurance. It was a completely made up term by a marketer for health insurers. That's it.
Yeah. Once you know the backstory,
It's
you know,
maddening.
Then someone said the truth will set you free, but at first it'll make you mad.
It's maddening.
It is maddening. So if every physician listening remembered just one lesson from the healthcare heist, what would you want that lesson to be? What's the big takeaway?
I think the big takeaway is we need to start learning how to be intimate with our patients. Again, not physically intimate, not intimate when they come into our office and have a problem. But out there in the world, we need to start communicating with our patients, our friends, our family members, letting them know what's going on, because that's when we can all band together. We can become allies and we can fix the system. If you ever watch The Pit, I don't watch The Pit because it's too PTSD inducing for me, but I've heard that it does a very good job of actually describing what it can feel like to be a physician, especially in stressful situations. We need to do more of that stuff. That's how we change the world. That's how we spark revolution, one person at a time. We need to tell our stories, just like A.J. Cronin did with the Citadel.
Yeah. Here's one final question here, and then I'll open it up to whatever direction you'd like to take it. Imagine a physician driving home tonight after a 12-hour day, feeling exhausted. Maybe it's a 36-hour, 24-hour day. And they're feeling exhausted, frustrated, and wondering whether medicine is still worth it. What would you want that doctor to know after reading The Healthcare Heist?
I would want them to know that what they're feeling is just. What they're feeling is exactly what they should be feeling. We've been taken advantage of, and our patients have been taken advantage of. And so the question we all have to ask ourselves is to throw it away, walk away, find another job, or are we going to fight for the revolution that needs to happen? When we took that Hippocratic oath and said, we want to help our patients, we care for each and every patient, we're going to do what we can in our power to heal them. Well, this is what now the Hippocratic Oath is also asking us. It's asking us to stand up and not accept the status quo, not accept these third parties that are putting their hands in the cookie jar and removing all the cash out of the system, meaning that we're not spending our healthcare doctors on patients. We're spending them on third-party businesses, which are extracting everything they can from the system. If we truly care about patients, we are not crazy. We still love medicine. But we've got to do something about it. We've got to tell our stories. We've got to reconnect with our patients, and we have to push for this revolutionary change that has to happen.
Yes, that's a good point. Is there anything else you wanted to cover? I want to make an offer here, too, for the doctors that are listening. We've got 5 books. The first 5 doctors that will just send me your contact information. We will make sure we get this book, The Healthcare Heist, in your hands. Send me your name and your address, email, whatever it takes to get a book to you. Send that to kdsullivan@warnerwm.com, and we'll make sure that you get that book. We'll take the first 5 that respond. We'll get this book into your hands. Very worth reading. I've got the e-version of it. I even ordered a hard copy myself of it. I was hoping it would come in time for today's podcast, but at least thank you for sending the e-book over to me. But any closing comments that you would like to make, Dr. Grumet?
Yeah, I want to let especially all those physicians out there know who are feeling burnt out right now, that you are seen and you are valued and what you do is important. And although things feel really bad now, I believe that you are important and there is a way to make this better. I believe that we all can come together and make this better. I don't think it has to be this way. I don't think we have to, accept the status quo. Hang in there. What you do is important.
Well, thank you, Jordan, for joining us once again today. One of the themes that really stood out to me today is that many physicians have spent years believing that they were somehow responsible for fixing problems that were never theirs to begin with. The pressures, the frustrations, the moral inquiries many doctors experience may not be the personal failures at all, but the symptoms of a healthcare system that has drifted away from its original mission. What I also found encouraging is your message that the solution isn't necessarily found in more technology, more regulations, bureaucracy. Instead, it may begin with something much more human, like you were saying, rebuilding trust and connection and partnership with physicians and the patients. So for our listeners today, I hope today's conversation serves as a reminder that your value as a physician extends far beyond productivity metrics, RVUs, patient satisfaction scores, administrative checkboxes that you were talking about early on. The relationships is yours to build. It's the lives that you impact and the trust that you still earn, which are still the heart of medicine. So if today's discussion resonated with you, I encourage you to pick up a copy of this book, The Healthcare Heist. Continue exploring these important ideas. The first 5 of you will get it on us. And as always, thank you so much for joining us on Physician Wealth Meds. If you found value in the episode today, please subscribe, share it with a colleague, leave us a review. Until next time, remember that building wealth is important, but preserving your purpose, that your impact may be the greatest investment that you'll ever make, and that's that one-on-one relationship with your patients. So thank you so much for joining us here today. That's our podcast for today. And remember, if you're not working on your personal wealth, who is? Please share this podcast with your friends and colleagues, and make sure you subscribe, like, and share. Any questions about what you heard today, please send an email to kdsullivan@lpl.com. Physician Wealth Meds, wealth medicine for doctors. Jordan Grumet, MD, is not affiliated with or endorsed by LPL Financial or Warner Wealth. The opinions voiced in this show and the podcast are for general information only and are not intended to provide specific advice or recommendations for any individual. To determine which strategies or investments may be suitable for you, consult the appropriate qualified professional prior to making a decision.